me share my screen. So namaste everyone. Good evening USA and good morning India. Myself Vaidya Pragati. I would like to welcome you all to GCAR Journal Club February meeting 2025. So just to give a brief introduction about what Journal Club is all about, it's an educational initiative by GCAR where we discuss published research articles and critical analysis to stay updated with latest research and promote evidence-based Ayurveda. GCAR or Global Council for Ayurveda Research is an international nonprofit organization based out of USA with a sister chapter in India by the name of Ayurvidya Anusandhan Abhiyan Foundation, AAAF. Our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please consider joining us as a member, which will bring you access to all our resources, and no nonprofit can operate and succeed without volunteers. So consider joining us as a volunteer, and we can place you in a variety of projects based on your skill and interest. Once again, our website is www.ayurvedaresearchusa.org. Now, I would like to introduce you to our eminent speaker, Dr. Rohini Purohit. Dr. Rohini Purohit is an associate professor in Department of Panchakarma at Alva's Ayurveda Medical College and Hospital in Mudbidre, Dakshin Kannada district, Karnataka, India. She is the co-founder of Abhinava Ayurveda Chikitsalay in Bantwal, Dakshin Kannada district, Karnataka. Dr. Purohit completed her Bachelor's of Ayurveda Medicine and Surgery at Government Ayurveda Medical College and Hospital in Mysore and earned her MD Panchakarma at KLEU BMK Ayurveda Mahavidyalay in Belgavi. She is currently pursuing a PhD through Rajiv Gandhi University of Health Sciences. Dr. Purohit has completed various research projects as an investigator, co-investigator, and guide, which have been funded by organizations such as CCRAS, RGHS. Her research areas include the impact of various Panchakarma therapies on Alzheimer's, dementia, the effect of Nasya on memory in students, voice parameters in singers, modifying and evaluating the Ayurveda formulation Kasahara Arka into nebulizing liquid, and designing and evaluating new equipment in Panchakarma. She has received various awards in national level article writing competitions and paper presentations, and has published scientific papers in peer-reviewed journals. Dr. Purohit has delivered lectures related to Ayurveda on radio, television, and various platforms. Additionally, she is involved in teaching research and biostatistics to undergraduate and postgraduate students of Ayurveda. She also holds the additional responsibility of biostatistics coordinator at Alva's Traditional Medicine Archives Research Center and serve as the team lead for research and development at Alva's skincare unit, which is involved in producing Ayurveda skincare products. We welcome you, Dr. Rohini Purohit. Over to you.
Thank you. Thank you, GCAR, for the opportunity, as well as I thank Anita Yadav for connecting. So I'll start my presentation.
Yeah, it's taking. Yeah, it takes some. Yeah, we can see
It's
your.
visible?
Yeah.
Yes.
Yeah.
Okay. So it's a GCM presentation. So first of all, I would like to state that it's for academic and educational purpose. And this presentation is meant for scholarly discussion and is not intended to provide medical advice. Also, it is to highlight the importance of publication as well as to understand how better we can publish. And it is not aiming at discrediting or highlighting the faults in any study. And also it is not intending to give any kind of medical advice. Also, attendees are encouraged to review primary sources and exercise independent judgment. So today's presentation is regarding mind relaxation effect of Jatamansi Taila Shirodhara on psychological distress in TNBC patients, results of open label randomized controlled clinical trial. This has been published by Sadanand Sardeshmukh et al. And their affiliations, we can see they are from Cancer Research Center, Cancer Treatment and Research Center, and Pune, and Department of Kaya Chikitsa, APN's Ayurveda Mahavidyalaya, Sion, Mumbai, Maharashtra, and she's the corresponding author, as well as few of the faculties are from Tilak Maharashtra Vidyapith, Pune, Maharashtra. So this was published in Journal of Ayurveda and Integrative Medicine, which is published by Elsevier. It is PubMed and Scopus indexed. Also, it has been published recently on 27 January 2025. The link is below. So the abstract, it highlights the challenges that the patients of TNBC face and the importance of Shirodhara here and the effect. So TNBC is triple negative breast cancer, which possesses a unique treatment challenges. It often leads to increased psychological distress in patients. Also, the psychological impact includes anxiety, depression, and reduced quality of life. Managing this distress is crucial, as well as this stress acts as a precursor, as well as it might worsen the prognosis. So hence here they have planned Shirodhara, which is an Ayurvedic therapy which offers a potential mind relaxation effect. It aims to alleviate psychological distress. So the methodology included 72 patients, wherein the control group received Shamanaushadhi and the trial group received Jatamansi Taila Shirodhara as well as Shamanaushadhi. And the effect, we see that they were relieved of anxiety and psychological distress immediately after the Shirodhara procedure. It also was effective in improving the quality of life and symptoms related to breast cancer, which was measured by QLQ C30 and QLQ BR23 questionnaires. So the background. Triple negative breast cancer is breast cancer which lacks the expression of estrogen receptor, progesterone receptor, and human epidermal growth factor receptor. So these three receptors are lacking, and psychological distress is a major risk factor of TNBC. Patients diagnosed with TNBC are under tremendous stress due to aggressive nature of the disease, and stress hormones decrease the efficacy of therapeutics. These facts underscore the need of mind relaxation treatment for TNBC. So this is the abstract that is there in the article. Coming to the introduction, breast cancer is the most common female cancer worldwide, representing nearly 25% of all cancers, with an estimated 1.67 million new cancer cases diagnosed yearly. So among them, the triple negative breast cancer is a subtype of breast cancer which has aggressive natural history and worse disease-specific outcomes compared with other breast cancer subtypes. Its onset is an early age, as well as it has high mean tumor size, higher grade tumors, higher rate of node positivity, more aggressive, less or unresponsive to standard receptor mediated treatments, and associated poorer overall patient prognosis. Visceral and soft tissue relapse are common features. So hence this TNBC is what they are mainly concentrating on. And here they say that it is a subset of individuals who may develop clinically significant depression among these TNBC TNBC patients. And these studies reported, interestingly, that differences in prevalence between high levels of difference and major depressive disorder was like 41% and 11% among newly diagnosed breast cancer patients. A recent cross-sectional study on 178 patients with cancer showed that almost half of them had significant anxiety, but anxiety disorder and its subtype was present in 18% of patients. Also, it plays a significant role in the etiology, progression of disease, and prognosis of the disease. Prolonged exposure to these stress hormones and psychological responses can disrupt various systems in the body, including immune function and inflammation regulation. So hence, only treating the tumor would not be sufficient. Hence, concentrating on the psychological aspect of the female could fasten the treatment, could fasten the response to the treatment, as well as it could improve the quality of the life, is what the authors have planned here. So in Ayurvedic literature, we find the various psychological components discussed. It could be under the heading of Chitta Kshobha, Tapta Chitta, Mana Vikshobha, or it could be Aswastha Chitta, Anavastita Chitta, which means fickle or unstable mind, and also Chittodvega, which can be roughly correlated to anxiety. So these have been mentioned in Ayurveda already, and in Ayurveda it says all these are mainly caused due to Asatmendriyata Samyoga and Prajnaparada and Parinama, which leads to the increase in the Pitta and Kapha dosha, which means Ayurveda clearly explains that when mind is involved, or when there is a disturbance in the mind, it affects the physical component of the body also, and that is what we see here in this TNBC pathology as well, and that is what the authors are trying to concentrate here. So the three treatment modalities which have been described for Chittodvega are, like any other treatment, Daiva Vyapashraya, Yukti Vyapashraya, and Sattvavajaya. Here, the authors have selected among them mainly the Yukti Vyapashraya Chikitsa, and the Yukti Vyapashraya Chikitsa, many medications are also available, Shamana Chikitsa, as well as Panchakarma, as well as there are other Bahir Parimarjana Chikitsa, which is considered as allied therapies here. And allied therapies mainly like Shirodhara, Shirobasti, Viddhakarma, Agnikarma, etc. are the treatment protocols which are proven and also been indicated for all these psychological disorders. So therapies advised for relaxation include Nasya, and then Shirobasti, Shiro Abhyanga, Shirodhara, and Shiropuchu. And among them, the authors have selected Shirodhara. They have selected Shirodhara because various studies have already proven the benefits of Shirodhara, and the clinical benefits observed with Shirodhara in anxiety neurosis, hypertension, and stress aggravation due to chronic degenerative disease could be mediated through these adaptive physiological effects. And also open label study carried out on 16 healthy volunteers proved that Shirodhara leads to a state of alert calmness similar to the relaxation response observed in meditation. So as good as a meditation, we already know the benefits of meditation. It is already established, and the similar kind of effects we can get by this Shirodhara procedure, because meditation requires a lot of practice. Not everybody can reach up to that level, can get the maximum benefits of meditation. So Shirodhara would be a better effect, as well as Shirodhara involves certain medications also, the absorption of which will have a better effect on the body. And this has been proved in various other researches as well. So hence for Shirodhara, they have selected here Jatamansi Taila. So Jatamansi Taila is an herbal oil with known therapeutic properties. It is derived from Jatamansi plant. We already know this Amalaki Jatamansi is used in Takradhara as well. Jatamansi is given orally as well. So here they have prepared a specific Taila only using Jatamansi, Ekamulika Prayoga. Traditionally used in Ayurveda for neurological and psychological benefits, its anxiolytic effects are well documented. And also the potential benefits, it promotes relaxation, reduces anxiety, and improves sleep. It helps in balancing the mind, and that is what is expected in this case. So hence they thought of trying this Jatamansi Taila in the form of Shirodhara for TNBC patients. So the study objectives and hypothesis were to assess the mind relaxation effect of Jatamansi Taila Shirodhara, We'll observe psychological distress in TNBC patients, and the hypothesis was Shirodhara with Jatamansi Taila will significantly reduce psychological distress was their hypothesis, and results were compared to the standard care, which was the Shaman Aushadhi in the control group. And secondary objectives was to evaluate the impact of sleep quality and overall well-being, the quality of life, which is most important, which is most concentrated on when we are treating any kind of cancer patients after they have undergone the conventional therapies. So here the inclusion criteria included the patients who were aged around 20 to 70 years, as we saw in the previous description of TNBC, that it affects since the younger age itself. So it could be any age group that could be affected by TNBC. Hence, they have a broad range of age group here, that is 20 to 70 years, who were diagnosed with TNBC, which was proven with histopathology and immunochemistry, estrogen, progesterone 1, and HER2 receptors came as negative, and who have completed their conventional treatment with mild to moderate symptoms of psychological distress, and they are willing to get enrolled into the study were included here. And any patients who were below 20, above 70, and having a history of other psychological illness or were not willing to participate were all excluded. Psychological distress, they compare that to Chittodvega here. It could be either anxiety or depression. So they have tried to include all different kinds of patients. Anybody who's having any kind of psychological distress, which is due to TNBC, means anybody is having before TNBC any psychological distress, were excluded, which means it is only because of the disease that they have got the psychological distress, or because of the challenges they are facing during the treatment. The group of symptoms selected on the basis of signs and symptoms mentioned in the classics of Ayurveda as well as modern science. Severity of anxiety and depression was assessed by SAS and SDS scales, and the references they have mentioned appropriately. And according to the scale, it says that somebody who falls in the criteria of 20 to 44 score, then they are considered as normal. If it is 45 to 59, it is mild to moderate disease. 60 to 74, marked or severe, and 75 and above is referred to as extreme disease condition. All routine hematological investigations like hemogram, liver function test, renal function test, C-reactive protein, and cancer antigen for breast cancer were carried out initially to exclude other comorbidities as well as monitor the progression of the disease. This is a very good step that the researchers have taken here, because it is well documented, and also we know that the patient is not having any progression in the cancer wise also, because they have all these questionnaires to assess the mental component. For the physical component, they have these hematological investigations which they have done before treatment, during the follow-up, during the treatment, and also after the treatment. So clinical trial, they have the trial design here, which is open labeled randomized control clinical trial, as RCT is considered as a gold standard. This is a very nice design that they have selected. Patients were assigned to Shirodhara and the standard care. Standard care is the Shaman Aushadhi here. And the participants, TNBC patients experiencing psychological distress, patients meeting inclusion and exclusion criteria were selected. The intervention was Shirodhara group received Jitamamsi Taila Shirodhara, and the process was standardized. They have mentioned exactly how they have done the procedure, and the same was maintained for all. So that nullifies any kind of bias due to the procedure. Outcome measures, psychological distress measured using standard scales, and measures include questionnaires at baseline, D7, and follow-up. So they have checked it 3 times, and it's good that it can be comparable. So group A received Shirodhara with Jatamansi Taila for 7 days along with continued palliative treatment, that is the Shamana Chikitsa, and group B received only the palliative treatment. So what is the Shamana Chikitsa protocol? That also they have given in detail. So they are Swarna Bhasmadi Vani, 395 mg with cow's ghee twice a day after morning and evening breakfast. Swarna Malini Vasanta, 250 mg with cow's ghee twice a day after morning and evening breakfast. Shatavari Vati, 500 mg with water after lunch and dinner. Trifala Gokulu, 500 mg with water after lunch and dinner. Arogya Vardhini Vati, 500 mg with water after lunch and dinner. Mauktika Kamatuka Vati, 500 mg with cow's milk twice a day after morning and evening breakfast. So they have mentioned in detail what is the protocol of Shamana Chikitsa that they have followed, and they have told that it is Same for both Group A and Group B. It is only the Group A which receives Shirodhara as a extra therapy along with these Shamana Chikitsa. So Shirodhara, patients of Group A who received Shirodhara were admitted to the inpatient department for 7 days. And prior to the commencement of the treatment, they were investigated for routine blood investigation that was discussed earlier. And they were treated with pre-procedures. Mainly, they have done Snehana and Swedana they have given here. So they have not exactly mentioned which Snehana and Swedana. Probably it is Abhyanga and Sweda. Type of Sweda also has an important role in the treatment of any kind of disease. Like there is types of Sweda mentioned for different types of dosha. Hence, probably they could have specified which kind of Swedana was done, could have given more details here. The procedure was conducted every morning for 20 to 30 minutes of duration, and patient was asked to lie down in the supine position on the Shirodhara table, and further the procedure was carried out as per the normal Shirodhara procedure. I would like to draw your attention towards the distance between the Shirodhara pot and forehead that they have mentioned is 10 centimeter. That, I believe that is the SOP that they have made after measuring the 4 angula, and they've standardized it to 10 centimeter, and they have maintained the same for all the patients. And also another interesting point that was observed here was they have told that they have taken lukewarm Jatamansi Thaila, which is 500 ml per sitting. So generally the amount of oil or any kind of liquid that we use for Shirodhara that we use would be around 3 liters. But here they have mentioned 500 ml. Why they have reduced it to 500 ml, or what was the type of container that they used? Did they modify the Shirodhara procedure? It has not been mentioned. Probably if they use a very small container for the pot, then maybe 500 ml might be sufficient. But the general protocol is that we use around 3 liters of the liquid. And another interesting point that they have mentioned here is after the procedure, the patient was asked to take rest for 30 to 60 minutes and allow the oil to seep deep inside the head. So this is something which is not followed always. So that is also a little questionable, like why did they opt that specifically 30 to 60 minutes and that the patient is sleeping? Because we instruct them not to, which they have also instructed that to avoid direct exposure to wind and sunlight, chilled and heavy food intake and daily head bath. So the room has to be maintained warm if the person is sleeping with the oil for 30 to 60 minutes like that. So if they have maintained that temperature within the room, then it is fine. If not, that might lead to complication. But since they have not reported any kind of complication, probably they have maintained the ideal temperature inside the room, which is not detailed here. So the follow-up during the baseline visit, that is day 0, time point is denoted as day 0. The patient was evaluated clinically and assessed with SAS, SDS, and Karnofsky Performance Status, that is KPS. The health-related QOL was measured based on QLQ-C30 BR23. Also, the blood sample was withdrawn before commencement and after completion of the study for hematological, biochemical parameters and inflammatory tumor markers. The study duration is for 30 days. That is 7 days they do the procedure, and after that for 1 month, for 30 days, they give the medications, and then probably the patient is discharged on 7th day, and then the patient has to take the medications at home. So the results generally suggest that the group which took Shirodhara is better. So let us see on which aspects it has shown better result. In the present study, the maximum number of patients belong to 41 to 60 years of age group. That is group A 77% and group B 54%. Of stage 2 46% and stage 3 29% and grade 3 69%. Majority of women received conventional treatment including surgery, chemotherapy and radiotherapy before taking this Shirodhara or Shamanaushadhi. But they have not restricted to people who have taken only chemotherapy or only radiotherapy or only surgery. Either it could be any of these or all of these depending on the case, but they have included them after these therapies are completed. So there might be few variations in the sample is what I believe. Effect of Shirodhara on the psychological distress symptoms at different time points. The comparative analysis of symptoms gradation was carried out at time point D7 and D30 so as to find out the immediate and long-term effect of Shirodhara in both groups of TNBC patient. The symptoms like crying spell and fearfulness, which is the symptoms related to psychological distress, were found to be significantly increased in the control group patients in both the time points, while difficulty in concentration was observed to be remarkably increased in study patients at time point of D30. So that is in the Shamana group, there was no much reduction, rather there was a little increase which was seen in crying spells and fearfulness. There were no statistically significant changes observed in the restlessness, anxiety, irritability, worthlessness in both the groups at time point of D7, but we see that later it has decreased. While restlessness and anxiety were found to be decreased in group B, however, irritability increased in group B at time point of D30. So initially, little decrease was seen in group B, but irritability was found to be increased. People who were taking only Shaman Aushadhi. Other symptoms like dryness of mouth, easy fatigability, suicidal thoughts, tachycardia, sleep disturbance, dyspnea, increased frequency at urine and stool, tingling and numbness, fainting did not show significant difference at both time points in both the groups. Significant improvement was observed in group A patients at time point D7 and D30. Means when they compare before and after in group A, they found that it was significantly reduced, but they when compare between the groups, there was no significant difference in those symptoms. KPS was significantly improved in group A as compared to the group B, indicating improvement in functional improvement and survival. FS of QLQC30 was found to be improved in group A as compared to group B at both the time points, while SS was significantly decreased in group A as compared to group B, indicating the lower symptom load. The GS did not show any significant alteration in both groups at all time points. So these are the methods of assessing the symptoms of TNBC or the breast cancer symptoms, and those also were to some extent decreased, which we can see in group A, that is of Shirodhara. The SS of BR23 showed marked significant decrease in group A at both the time points, while functional score of BR23 did not show any significant difference in the study and group B at both time points. Effect of Shirodhara on SAS and SDS. SAS and SDS in both the groups after 7th and 30th day were within normal scale. However, SAS and SDS were found to be significantly decreased in group A at the 7th time point as compared to group B. So immediately after Shirodhara, it was found to be better in group A. Again, these are the symptoms related to breast cancer. The immediate and long-term effects of Shirodhara therapy on psychological distress symptoms were found to be significantly decreased in group A. So statistical analysis and significance, data analyzed using appropriate statistical methods. This included t-test and ANOVA. Statistical significance set at p less than 0.05. This ensured reliable results, and significant difference between Shirodhara and standard care groups. Results confirm the hypothesis. So discussion how Shirodhara helps and comparison with existing literature. So here we can see that they have tried to compare with the existing studies and give the information regarding how Shirodhara has helped in TNBC patients. So mechanism of action has been detailed here. They have tried to detail that Shirodhara promotes relaxation through the autonomic nervous system. It modulates stress hormones. And the comparison, they have tried to find various articles related to their study, and their findings align with the existing literature on mind-body therapies. These offer psychological benefits. And also they have tried to analyze it based on the Ayurvedic parameters that is available that is the Manovaha Sroto Drushti is what they have concentrated on discussion part regarding Shirodhara, and they have tried to establish that the purpose of selecting this Tyler for Shirodhara is because there is a Vata Vriddhi whenever there is this Chittodvega, and hence it will help in controlling that psychological distress, as well as it has an positive effect on the breast cancer reducing factors. And the novel TT study provides specific evidence for TNBC patients. There's a need for targeted interventions as well. The sample size is also quite good here, so we can consider it as a good evidence here. So implications and future research. Shirodhara may be integrated into supportive care. It can improve the quality of life for TNBC patients. The research direction, future research should explore long-term effects. Also, cost effectiveness should be studied. The study extensions, larger sample size and diverse populations are needed. This is to confirm the findings. So the author contributions have been mentioned here in detail, which shows that all the authors have substantially contributed for the study and also for scientific writing. They have also declared here that during this work, author did not use AI tools in writing the draft of the paper, and they have claimed that they have not received any funding sources. Conflict of interest. This is an interesting point to note here. Jatamansi Taila has been partly included along with the mentioned Shamana Chikitsa as herbo mineral metallic pharmaceutical kit, and they have applied for patent and published as well as in PCT application for triple negative breast cancer patients. So that is a commendable thing, which I think should be done more and more in Ayurveda. Acknowledgement, they have rightly given the acknowledgement to the institutions as well as those who were involved in the study. And they have also given the appendix, which has the detailed questionnaire regarding scoring and grading chart, which is attached to this in the said link. The strengths of the study. So if we look into the consort guidelines and try to analyze this study as per the consort guidelines, here it is clinically relevant research. It addresses an important issue, that is a psychological distress in TNBC patients, an area with limited complementary treatment options. It highlights the potential role of Ayurvedic therapies, expanding the scope of integrative oncology. This is a best example for a collaborative research or a integrative therapy protocol. That is, they have tried to assess, the allopathic factor has tried to address the tumor component and have tried to limit the growth of the tumor, and the further treatment is taken up by Ayurveda, where they have tried to improve the quality of life, have tried to address the psychological distress, as well as have tried to see that there are no progression in the tumor or there are no new tumors that have developed, at least during this therapy period. So that is commendable. Clear intervention and methodology. They have well-defined intervention, and the control group also is structured, and there is a structured comparison there. Outcome measures include validated psychological distress scales, the various scales that have been used, that are used by various other studies also. So those are standardized scales, ensuring objective assessment. Patient flow and baseline comparison. Study provides a flow diagram making patient tracking transparent. Though for the design, blinding is expected as per consort guidelines. Blinding is very difficult with respect to many of the Panchakarma treatment protocols, because like Jatavansi Thaila, even if they have another group with a Thaila, still the fragrance of Jatamansi will make the difference, and the patient will know that this is a different drug that they have used. So blinding is not possible. Hence, I don't consider that that as a flaw in the study. It is not possible here. Areas that could have been better, as per the consort analysis, study limitations and recommendations. Statistical analysis could have been detailed a little more, because they do not exactly mention which tests were used in which of the parameters. So that could have been detailed. And ethical and transparency issues, especially they have rightly mentioned that they have taken the ethical clearance from the institute, from the IEC. but they have not mentioned whether the trial is registered in CTRI. If it is registered, then they should have mentioned the number, because that is a mandatory rule for all the clinical trials to be registered in CTRI before they commence the study, and hence that is lacking here. No adverse event reporting, so safety concerns are left unaddressed, because as such we know that Jatavansi Thaila Shirodhara is not having any such adverse effects where, when we do it for many patients, like say for hypertension we would do it, maybe for psoriasis we do it, or many such patients we would do the Shirodhara procedure. There are no reported adverse events, true, but this is being done along with the Shamana Chikitsa, which is something given orally, and it's an external therapy as well as an internal therapy which is combined, as well as it is for TNBC patients, the cancer patients. It's a very sensitive issue, and here the adverse event reporting plays a very important role, I believe, and hence they should have mentioned them if they were there or they were not there. And study highlights procedural benefits, as the other group had no Shirodhara, but it does not establish the role of Jatamansi Thaila, is what I believe. There are already previous studies which have tried to compare, like say Thailadhara with um, like say dhara with using just water, jaladhara, or they have tried to compare Murchir Tilataila dhara with some medicated oil dhara, and many a times they have tried to prove that it is having a better effect, the one which is having a medicated thaila. And some studies have also established that both are having kind of equal effect. So, but in this study, what happens is only one group is receiving Shirodhara with Jatamansi Thaila. The other group is not at all receiving Shirodhara. So we can attribute the findings of the study mostly to Shirodhara procedure as such, and claiming that it is the Jatamansi Thaila itself which is giving the result is not the evidence that is given here is not enough to prove that, is what I feel. If there was another group which was receiving Murchir Tilataila and probably that was compared, then probably we could understand the effect of Jatamansi as such in this thaila, apart from the procedural effect, because Shirodhara procedure itself has its own benefits, because even as simple as Jaladhara has also substantial benefits in reducing, like say in cases of hypertension, where it can be given as a immediate treatment, like patient is hypertensive, maybe you have started, you want to post a patient for Abhyanga or any such Panchakarma therapy, and patient has elevated blood pressure levels, then if we give Jaladhara, that will reduce. But of course, that's not a complete treatment. He would require some other medications. But if it is a excuse me, some transient increase of this blood pressure, then that is sufficient. So hence, Jatamansi Thaila, how much effect it is having is actually not being established, is what I feel. Excuse me. In both groups, D7 is assessed. So was the other group without any treatment for D7, or any placebo capsules, etc. were given to keep up the patient flow follow-up, is not clear. They have given the treatment for group A, Shirodhara, first day to 7th day, then they are assessing on 7th day, is fine. But for group B also, they say that they have assessed on day 7. So that means from day 1 to day 7, the patient was without any medication. So was it maintained like that, or they gave some placebo capsules to the patient so that they come for the follow-up on the 7th day? So that part is not clearly mentioned, is what I felt. They could have detailed that. Since patients had already taken treatment, were all of them devoid of any other medication, or if present, were they tapered, hasn't been discussed here. So they have rightly mentioned that they have undergone the conventional therapy, but post-surgery or post-chemotherapy, radiotherapy, etc., were they put on any other allopathic medication, or were they completely devoid of these medications, or were they tapered before starting our Ayurveda medication? That could have been detailed, or just a sentence of they were not on any medication also could have been sufficed, so that we know that there is no bias involved there, because if some patients are taking allopathy medicine along with Ayurveda medication and some patient is taking only Ayurveda medication, all that makes difference in the results. So that should have been detailed is what I feel. So just comparing with the existing information, first let us look into TNBC a little bit. So triple negative breast cancer is a subtype of breast cancer characterized by the absence of estrogen receptors, progesterone receptors, and human epidermal growth factor receptor 2 expression. This means that TNBC does not respond to hormonal therapies or treatments targeting HER2 receptors, making it more challenging to treat. TNBC accounts for approximately 15 to 20% of all breast cancer cases and is known for its aggressive nature, higher likelihood of metastasis, and increased risk of recurrence compared to other breast cancer subtypes. Also, patients with TNBC often experience significant psychological distress due to the aggressive nature of the disease and limited treatment options. So, for instance, research indicates that 67.3% of breast cancer patients experience significant distress and 41.9% report very high levels. Factors such as younger age, presence of TNBC, tumor recurrence, metastasis, and inability to work are significantly associated with increased psychological distress. So, since breast cancer itself is associated with psychological distress, I feel this study could be tried, or this protocol can try patients also apart from TNBC. Probably that also might yield good result, because we see that all these breast cancer patients have a significant association of psychological distress. The transition from active treatment to surveillance is a critical period for TNBC patients, often accompanied by heightened anxiety and fear of recurrence. Patients have expressed a desire of psychological support during this phase to help manage the unique challenges they face. Hence, this treatment is quite relevant, as the patients themselves feel that they would require some treatment for the psychological distress that they are facing. So in summary, TNBC is a distinct and aggressive form of breast cancer with unique clinical and psychological challenges. Comprehensive care approaches that include both medical treatment and psychosocial support are crucial to address the multifaceted needs of TNBC patients. Now, looking into the important researches that have happened in TNBC. So what is the success rate there? If we have to see, recent advancements have introduced promising treatments for TNBC. So there are various drugs and antibody drug conjugate targeting the TROP2 receptor delivery cytotoxic agent SN38 directly to cancer cells. In clinical trials, it has achieved an overall response rate of 33.3% in patients with metastatic TNBC who had undergone at least 2 prior therapies. The median duration of response was 7.7 months with a median overall survival of 13.0. Then there is another drug, that is a immunotherapy drug which they have tried, and it has shown significant improvement in overall survival and reduced recurrence in high-risk early TNBC patient. A large international trial reported life-saving outcomes, leading to its adoption as standard care of this cancer type. And also, interestingly, there's a vaccine which is available, which has good results. And here, 16 out of 18 patients remain cancer-free 3 years post-vaccination, indicating potential as well as preventive strategy against TNBC recurrence. These are the developments that have happened in TNBC treatments. And let us see what is the effect of stress on tumors in general. So it has seen in mice, in animal study, that the stress had a significant effect on the tumor, where like acute stress enhances cellular immunity and did not have a much growth of the tumor. The chronic stress had an effect on the tumor. Cognitive behavioral stress management in colorectal cancer patients. Here, the RCT assess the impact of CBSM, that is the cognitive behavioral stress management, on anxiety, depression, and quality of life in colorectal cancer patient post-tumor resection. While the study focused on psychological outcomes, it did not report direct effects on tumor size or recurrent rates. The improvement in mental health parameters suggests potential benefits in overall patient well. Also, they have tried to include stress management and inflammatory markers in breast cancer research. Research examined the effects of brief stress management interventions on inflammatory markers in breast cancer patients undergoing primary treatment. Study found reductions in specific inflammatory markers over 12 months in patients receiving stress management techniques. So these studies suggest that stress has a significant role on tumors. Also, stress management has a significant role on reducing the tumor to a certain extent. Importance of psychological distress management in breast cancer, especially. There have been many studies which have tried to address the psychological distress in breast cancer, and in quasi-experimental trial involving 47 newly diagnosed breast cancer patients, assess the impact of an integrated psychoeducation program, and these findings underscore the effectiveness of structured psychoeducational support in helping patients manage psychological challenges during the initial stages of diagnosis. Also, they've tried to incorporate yoga in the next study, where they have formulated a treatment protocol of cognitive behavioral therapy, yoga, and self-hypnosis on emotional distress and fatigue among breast cancer patients. And at a 9-month follow-up, the study found significant reduction in anxiety, depression, and fatigue in the self-hypnosis group and decreased anxiety levels in the yoga group. So we could probably include these protocols also in our treatments, since that has established a good result in reducing psychological distress associated with breast cancer. Also, there is lifestyle and supportive strategies studies which has done. So here they say that engaging in regular physical activity will help in reducing the psychological distress seen, as well as support groups will help in reducing the psychological distress, especially associated with breast cancer patients. Next, let us look into the various studies where Shirodhara has an effect on psychological distress management. So, major depressive disorder, where a randomized controlled clinical trial assessed the efficacy of herbal preparation combined with Shirodhara therapy in patient diagnosed with major depressive disorder. This suggests that Shirodhara in conjunction with herbal treatments may be viable alternative for managing mild to moderate depression, where ashwagandha oil was used here, was the conclusion of that study. And in generalized anxiety disorder, here they have given Shirodhara therapy for 7 days and a 1 month long administration of polyherbal mineral preparations. And here they have found that it has helped in improving the symptoms of anxiety and also the quality of life. And also combined therapies for anxiety, where 14 days they have given Shirodhara, and which has resulted in reduction in anxiety symptom as measured by Hamilton Anxiety Rating Scale. So these studies suggest that Shirodhara have an effect on the stress management, as has been reported in the paper that we have seen today. So studies on Jatamamsi Taila, we see that Jatamamsi Siddha Taila, here for a randomized single-blind controlled study, assess the efficacy of Shirodhara using Jatamamsi Siddha Taila in 60 patients with anxiety neurosis. The treatment group received Shirodhara with Jatamamsi oil for 14 days, resulting in a 73.33% reduction in anxiety symptoms, with no relapses observed during a 6-month follow-up. So that's a long follow-up that they have, and they have tried to establish that it is good, effective as a long-term treatment for anxiety neurosis. Also, they have tried to standardize and preliminary characterization of an Ayurvedic stress relieving head massage oil. They have tried to give it as a Shiro Abhyanga, where again they have tried to get good results by using Jatamamsi Taila even for Shiro Abhyanga. And here again, Jatamamsi Churna is being given internally along with Nirgundi Taila Padabhyanga, which has been assessed in insomnia. And here also they have found good results in improvement of the quality of sleep by Jatamamsi Churna. So internally as well as externally, Jatamamsi has been showing good effect on various symptoms related to psychological distress, including insomnia. So these findings suggest that the findings that we have seen in the paper today are in line with the other studies that are similar to this. So conclusion, Jatamamsi Taila Shirodhara significantly reduces distress. It improves well-being in TNBC patients. The therapy is safe and feasible intervention. It has minimal side effects. And Shirodhara offers a promising approach. It can manage psychological distress in TNBC patients. So this is the conclusion from the study. So thank you for your attention, and questions are welcome.
Yeah. So thank you, Dr. Rohini. That was an excellent presentation, and I can see the effort that was taken to present this presentation and the time you have taken to share your knowledge. And if anybody has any questions, this is the right time to ask her. Anita, do you have any questions, Dr. Anita? Okay, then I think because yeah, you clarified everything. Everything was clarified the way you presented, so it was easy to understand. And I really, as we all know that, yeah, Ayurveda doesn't even go with like symptomatic approach, and it's more of a holistic in a whole form approach. So mind and body both we take it into consideration. So that was beautifully explained. Thank you so much. Um,
Thank you.
yeah. So I think there's no questions. Somebody
Thank
is trying to log in. So thank you so much for attending this Journal Club meeting. Please watch and subscribe to our YouTube channel to stay updated with the latest research in Ayurveda. Please like, comment, and share the videos. Once again, I invite you all to become a member and also fill our volunteer form. You can also subscribe to our IU Update newsletter to stay tuned to our projects and events. If you have any questions, feel free to contact us at ayurvedaresearchusa@gmail.com. Thanks again. Thank you so much, Dr. Rohini. Namaste.
Thank you, GCAR, for the opportunity, and I thank you also.
Thank you. Namaste.
Namaste.